Welcome to the Uniform Services Asthma Action Plan Clinician Familiarization video. This video will demonstrate to you how our team has equipped this evolved asthma action plan with background JavaScript coding to make your classification and treatment of pediatric asthma easier. We'll start with the demographics at the top. You can place the patient's name and then the provider name, and you may select either the drop-down menu or just type in the patient's date of birth. For today's date, you could click the drop-down or just hit the button, and then you can provide the parent contact information or some other way and means to get a hold of them with their weight, and then your medical team's contact information. This will be key in a later portion of this video. Now, this plan is comprised of 3 sections apart from demographics: green, which is good; yellow, which is when they are getting sick; and worse, when their step-up therapies have failed and when they need to consider going to the emergency department. There are several features and enhancements added to this plan. First, with the click of a box, you can demonstrate the Allergy Asthma Network's respiratory inhalers at a glance so that you can depict this for parents and families if they haven't brought their records and medications with them to the visit. Next, we provide the NHLBI Asthma Severity Scale, which is age-based, so that you, the clinician, can review what clinical symptom points are most important in managing asthma with this 2020 guideline update. Next, we've also provided the NHLBI SMART Treatment Guideline that shows the stepwise approach to the management of asthma for the 3 different age groups. Now, we recognize that not all providers will have a long enough clinic visit to go through those charts. So this Acro dialog box allows you to capture patient age, their daily symptoms, as well as the other clinical points that are important for the severity scaling. Perhaps your 6-year-old cannot do PFTs, and then we would hit OK because that's the final symptom. You can see here that based on our coding algorithm, your patient is severe severity. You can review the NHLBI treatment and recognize that this is somebody who has persistent asthma. They are age 5 to 11, and they should start on a low-dose inhaled corticosteroid and a PRN SABA. So perhaps we would start with something like fluticasone at 110. You can see it automatically outputs a starter dose, a frequency, recommends a spacer, and then attaches a QR code link that you can either click and hit allow to pilot straight to the video, or use your phone QR reader to do the video in real time. Second, we should provide them with a short-acting bronchoagonist in the form of albuterol, and then we can show them additional things, and this requires you to put in the frequency itself. You can also say things to avoid triggers. So if your patient has a particular allergy, whether or not they should take this before exercise, because not everyone needs to. And then finally, you can see this provider contact information captures the same. Let's say you needed to change this. You could just retype it. You can see that that retyped updates here in these different dialog boxes. Now you can free text whatever message you want to be personalized to your patient, and then check yes or no if you want this child to use the inhaler and have it on their person at school. This is the end of our provider familiarization video. Thank you for your time.